Good morning, everybody. You are here at the Respite Services RFP Pre-Proposal Conference today on December 21st. Oh, can you pull up the slides? Yes, you can pull up the slides. If you can go to the second slide. Okay, next slide. Today we're going to be going through the RFP and the process. First, we're going to start with the welcome and introductions. If you can please state your name, the agency you're with, and what your position is at your agency, and for those that are on the team, your position in the RFP. I'm going to start. My name is Lorraine Hayes. I'm the Senior Contract Manager and Purchasing Agent here at JWB, and I am facilitating the Respite Services RFP process.
Hi, good morning. My name is Nanette Plegos. I'm a new nonprofit. Remember me for suicide prevention with mentorship, but I have a lot of collaboration with a lot of other nonprofits that deal with mental health, and the one that I'm actively pretty much working with right now is NAMI. I'm a state facilitator for family care specialist with them.
Thank you.
Good morning. I'm Larry Cooper, Chief of Prevention and Intervention Services at the Children's Home Network.
Okay.
And I'll be the lead on the Respite RFP for our program at Children's Home.
Thank you very much. I want to go over a couple of things really quickly. We are streaming on YouTube Live. However, there is no way to pose questions for those that are watching this on YouTube. Please follow the instructions in the RFP in section 1.5 to submit your questions electronically. For those of you who are present, you will have the opportunity to ask questions, and we will respond to them during our questions and answers portion of this pre-proposal conference. Again, we have the questions forms that you can fill out, put as many questions as you want on there. We'll also have a little quick break so you can add any questions you have, and then we'll answer them. Any answers here are not the official responses. The official responses will be in the questions and responses document. But just wanted to clarify for those of you who are streaming on YouTube, there is not that ability to ask questions. You'll need to follow the directions in the RFP. Karen Bogus is going to go over the scope of work, and then it's going to go back to me, and I'm going to do the timeline, proposal submission, proposal format and the forms, evaluation and award. Susie Patterson is going to do the TSL and methodology completion instructions. Then we'll have questions and answers. We also are encouraging collaboration and partnerships as part of this RFP. So we will have the room open so that anybody can network and talk. So you'll have about an hour for the room to be open. Okay, I'm going to go ahead and turn it over to Karen Bogus.
Good morning again. So we're going to start with what is respite. So the main goals of respite are to strengthen the family unit, to reduce stress, and keep the family intact and stabilized. Respite provides a temporary relief, which is time limited. We would like clinical oversight and assessment as part of these services, and providing additional family caregiver support and advocacy. Some background, JWB's fiscal year 21 through 25 strategic plan goal. This is under prevention of child abuse and neglect. Children will grow up and thrive in safe and healthy environments is the strategic goal. Strategy 4.3 in the plan is research that JWB internal staff were to research evidence-based and evidence-informed programming regarding respite and to procure and implement high-quality respite services. JWB had an internal team that researched best practices. Also, we surveyed providers in the community. Staff are recommending a more comprehensive respite system offering varied levels of service and additional supports for families and caregivers. An important element to the respite services is clinical oversight and assessment to determine risks and needs of families. Oh, I'm sorry, I keep forgetting that. Thank you, you're good. The results of JWB's evidence-based and evidence-informed research identified some of the following: family-centered approaches, comprehensive assessments and ongoing monitoring. Services must be age-appropriate, culturally appropriate, and trauma-informed, and appropriate caregiver training and qualifications. The objective. JWB is seeking proposals from agencies with the capacity and experience to provide evidence-based, evidence-informed, clinically sound respite services to JWB's identified target population across varying levels of care. So we've identified in-home respite being one modality, along with group respite, center-based care, overnight, weekend care, and or family-selected caregivers. Each agency may submit one proposal for one or more sites in Pinellas County and providing one or more of the modalities just explained. JWB encourages proposers to build and extend collaborations and partnerships in response to this RFP. You know, we recognize that there are several different modalities, a large span of age range, and so one provider may not be able to meet all of that. Why we are encouraging collaborations and partnerships, it's shared experience, leveraging community resources and facilities, providing a systems approach, enhanced program quality, and access to services for program participants' unique needs that they are presenting with. Collaborative proposals must be submitted by one lead entity and include the details of legal and contractual relationships between parties in the narrative. What is the target population that we are aiming to serve here? So caregivers of children within the age range of 0 to 13 years of age. Children must have a physical disability, so socio-emotional challenges, developmental delay, or a caregiver is experiencing acute situational stressors leading to strained family system. Children may have an underlying medical condition, however, they must be medically stable, not requiring medical care during respite services as confirmed by a qualified healthcare practitioner. Caregivers must reside within Pinellas County. Respite services must be limited to the target population, but proposals will be accepted that include further limitations if necessary in order to align with the proposer's capacity and experience to develop and implement evidence-based respite care services. So a great example of this, if a provider really has experience in ages 5 through 13, but not through infants, through 4-year-olds, and they submit a proposal for ages 5 through 13 for families residing in, say, a specific part of the county. What are the qualifications that we are requiring? Agencies' mission, values, and services must align with the proposed program. The agency must have experience providing community-based services to the target population, and the agency must have the financial capacity to support the commitments set forth in response to this RFP. The agency must have an annual operating budget the agency must have an annual operating budget over $500,000 or operate under an administrative services organization, an ASO, or collaborative as determined in JWB's sole discretion to ensure the proper administration of JWB funding. The agency must not operate under the exclusive jurisdiction of the public school system pursuant to JWB's special acts. For collaborative proposals, the lead entity must have demonstrated leadership, experience, and the ability to convene and collaborate with multiple agencies towards a single goal. The agency must have a broad base of experience developing integrated support plans following the principles of wraparound service delivery and providing ongoing care coordination to families with multifaceted needs. Program staff must have experience conducting clinically oriented centralized intake process that includes community and home-based clinical assessments, developing multi-domain formulations, and determining level of care requirements. Program supervisory staff must hold a master's level qualification or above in the field of mental health, child development, or related discipline. Oversight of the program must be provided by an individual holding licensure in social work or a closely related field. Program staff experience in the provision of trauma-informed care is highly desirable, and at a minimum, training in the principles of trauma-informed care must be provided to all program staff. The following are minimum service requirements of all modalities of respite care programming across the continuum: evidence-based and evidence-informed services, systems of care approach, intake and assessment, ongoing assessment of families, individualized sustainability plans, duration of care, and ongoing care coordination. Respite services themselves, if it applies for specific modalities, licensing requirements, whether that be through Pinellas County licensing childcare or through DCF, family engagement and support, trauma-informed care, nutrition services if needed, if it's overnight or longer-term care, family-selected caretaker, service hours, and program fees. Staffing, professional development, responsiveness to unexpected and unforeseen circumstances. So I just want to take a minute to just go over what we mean by that. So say a provider is working with a family and it's a single parent or a single caregiver, and all of a sudden that caregiver has an emergency situation and that child is in need of care outside of that home. So that's one of those for a responsive, unexpected, unforeseen circumstance. The program must start serving participants no later than October 1st, 2021, and there may need to be transition of participants from JWB's current respite program, which is due to end by September 30th. And this process will be facilitated by JWB staff. Now we move on to evaluation and performance measures. So we are requiring an evaluation plan be part of this RFP. The performance measures are the following. We look for 95% of children will have no verified report or abuse and or neglect during program participation as measured by independent verification with the Florida Safe Families Network. We are looking, again, 95% who completed the program will have no new or verified reports of abuse or neglect for a period of 12 months following case closure as measured by independent verification with Florida Safe Families Network. 95% of children will not experience an out-of-home placement during services. as verified through Florida Safe Families Network. And then 95% of children have completed the program will not experience an out-of-home placement for a period of 12 months following case closure. And all of these performance measures are typical of our programs under prevention of child abuse and neglect. Additional performance measures will be looking for 90% of families. Oh, you can move to the next one. Sorry. Oh, thank you. 90% of families will demonstrate improved functioning across multiple life domains during 12 months of program involvement. The program will maintain at least quarterly direct contact with 100% of the families served. The program will convene biannual parent engagement support groups, and the program will also convene biannual parent advisory groups focused on gathering of information to improve services from the perspective of program participants. JWB also welcomes the addition of other performance measures and outcomes chosen by the program or collaborative. Data entry, so agency staff must provide financial data in a designated JWB database, and JWB program and participant data must either be entered into JWB's designated database or directly uploaded to JWB. Both methods require adherence to JWB's Data Quality Manual, which is part of this RFP. Minimum contract terms and conditions. I now pass it over to Laura.
Thank you so much, Karen. Okay, I'm going to go over probably what people consider the more boring side of this thing, but minimum contract terms and conditions. So there is a sample agreement. It's attachment 1 in the RFP. We do want you all to take a look at that and look at all the requirements. You look through that, and then you're going to see on Form 5, we have every section of that agreement in Form 5. Exceptions to any of the agreement terms in the sample agreement must be identified in Form 5 and will be considered during the selection process. If no exceptions are identified, it will be deemed acceptance of all JWB contractual terms, and the proposer shall not object to include any such terms in a resulting contract. Next slide. So this is Form 5. As you can see, it's very small. I apologize, but there are a lot of terms and conditions in our program contracts. We have each section listed in there, and you can see comply, exception, and not comply. There's a little bit on the right-hand side that you can see. That is where you're going to actually state any of your exceptions. You want to make sure that you document what section and why, as that is your opportunity if there are any conflicts within that contract terms and conditions form. And this will be included in your packet for the proposal. Next slide. Insurance requirements. Insurance requirements can be found on that attachment 1 too. So there is an insurance section. Actually, I believe there's 2. The certificate of insurance must be provided within 10 days of the formal contract. We do want you to take a look at those insurance requirements and make sure that you can meet those insurance requirements. Auto insurance, we do have it stated that would be determined based on the provider's transportation practices. We don't know what type of insurance you're using, what kind of transportation, how many children. So what we would like you to do is go onto our website. There's that link that you can see, and it is actually on page 43 of the RFP. So click on that link based on the transportation you're proposing. Those are going to be the requirements that you're looking at. Next slide. The Rfp timeline, and it kind of switched around in our pre-proposal. It didn't, I apologize, it's a little bit all over the place, but our RFP was released on December 10th. Today is the pre-proposal conference. December 31st is the deadline for receipt of questions. So that's a very important date for those of you on YouTube or anybody else, that means that we need those questions to be submitted prior to noon on December 31st. Any questions that are posed after will not be considered in this in the RFP, and we will not be able to answer them. So please take a look at the RFP documents and come up with any of the questions you have prior to that date. Any of the questions that are asked today will also be included in the questions and responses. January 7th is when the written responses for the questions will be released. That will be posted on our website. January 25th is the technical assistance. Technical assistance is when you can come in and we can review the proposal to ensure that it has all the critical elements needed for the proposal to meet the minimums. January 31st is the proposal submission due date, which is by noon. Please, we have it in red, we have it bolded, we have it underlined. It's extremely important that we receive that proposal by that due date. There is no problem sending it in early, but however, even if you have had it 10 minutes late, and we do have to reject it. So it's a lot of work for you all, and we're very excited about the proposal, so we really want to make sure we drive that home. Again, that it also includes any technical difficulties. So if you have any issues where it's too large and you can't get it through, that's why we really do encourage you to submit your proposals early to make sure that it gets in by that due date. JWB is not responsible for any technical difficulties. March 4th is the evaluation committee meeting. This is where our team will come together. They've scored your proposals individually, come together, and they're going to discuss the scores and determine who will move on for shortlisting and for the interviews. So you can see there's interviews on March 23rd, 24th, and 25th. Please ensure that you have this date down. These are the only dates that we are doing the interviews, and so we do need your agency to be available on those dates. March 30th is our best and final offer. So in this RFP, we do have the ability to ask for a best and final offer based on the team's response. April 6th is the evaluation committee meeting. This is where the team is going to consider the proposal, consider your interviews, consider your best and final offer, and any financial resources that are received. And based off that, the team will recommend award to the board. The board is going to recommend, is going to make action for award on May 12th. Based off the board awarding, we'll announce our intent to award on May 13th. The actual contract itself will be executed on June 1st or before. Now, these evaluation committee meetings on March 4th, all of the meetings are actually open to the public. We encourage you to come to the meetings. You can hear what the team has to say about your proposal. It's very helpful as far as understanding how the team is looking at your proposals. And we do have public comment prior to any recommended action. Next slide. Proposal submission. These are your proposal must be signed by an authorized company officer. In our RFP, we actually state who is authorized to sign for your agency or organization. So please take a look at that. That is a critical element of this proposal. You need to use the required format. The proposal is to be sent to RFP at JWB Pinellas. Include Respite Services RFP and your name in the subject item, and of course your proposer's name is your agency's name. They must, again, we're going to see this in this presentation quite a bit, we must get them by January 31st by noon. Late submissions will not be considered. Again, y'all are working very hard on these proposals. Our team is very excited to review them, so we want to make sure that you're successful at getting it in so that our team can review them. Next slide. Other submission information. The maximum email size JWB can receive is 10 megabytes. This is one of our biggest issues when we receive proposals. So we can get it in multiple emails. So you can send in as many emails as you'd like, On my side, I put them back together in the way that they're supposed to be, so it doesn't hurt to send it in multiple emails. If you could please just maybe put that this is 1 out of 3, 2 out of 3, so I know if I've received all of your proposals. If you didn't get an email from me, you're going to get an email every single time I receive one of your emails. If you don't get it for one of them, you can call me, you can email me. So please, it doesn't hurt to pick up the phone and call me. I'll respond, and we can make sure we find your other email, or you can cut it up into more pieces. So just wanted to make that clear. We have that in quite a few of our RFP processes, so we do note that this could be an issue. Also, that if you try to send and it doesn't go through, you may not get a bounce back quite so quickly, so you don't want to wait till the last minute, because then your proposal could be late. So just want to make sure that we ensure success knowing this piece. It's the responsibility of the proposer to ensure that the proposal is received by the date and time. As stated, we'll reply to confirm emails, and it will be every single email you send, I will respond to. JW is not responsible for technical difficulties encountered during the submission process. Next page. The proposal format. The following documents must be emailed to JWB as attachments with the naming and electronic file formats shown. So we have the Respite Services RFP, which is a PDF, and we'll go over what is included in that. There are 2 Form 3s. One is for your proposed startup budget, and one is for the proposed annual budget. So there will be 2 Excels that you're submitting, and the directions on how to fill those out are found in the RFP in the 3.0 requirements section. Next page. So this is very small because there's a lot to jam in there, but the proposal format is as follows. Assigned addendum. So what an addendum is if there are any material changes that we make to the RFP. Could come out of questions or anything else, but that would be an addendum. It's going to be posted on our website. It would also be emailed to everybody who's requested the RFP. So if you have not asked for the RFP, you do want to make sure that you request it so that you get any of the any kind of communication information. So that would be the first one. We don't have any addendums at this time. But that does not mean after this date, December 21st, that we wouldn't have any. Form 1 is the proposal signature form. Again, signed. We do have the directions on how to sign, or who is authorized to sign. The table of contents. Form 2, which is the Tsl Methodology. The narrative response. Attachments. So we have the organizational chart, job descriptions, data quality manual, proposed implementation plan, standardized and empirically valid instrument sample, and current year adopted budget. Form 4 is our non-collusion affidavit, which needs to be signed. The contract terms and conditions compliance checklist, which is that Form 5, and your IRS W-9, which is Form 6. We do have attachment 2, which is a proposal checklist provided to assist proposers. That does not get included in your response. It's just a helpful document while you're reviewing your proposals. The Tsl methodology, the proposer is to complete and submit one Form 2 Tsl methodology along with the required attachments. The form is in a separate fillable attachment to the RFP, and the form should be filled out as directed in the instruction given towards the end of this pre-proposal conference by Susie Patterson. Okay, next slide. Proposed program budget. The proposer is to complete and submit 2 Excel program budgets. One is going to be the startup budget. That is from June 1st, 2022 to September 30th, 2022. And then an annualized budget, which would be from October 1st to September 30th. The budgets must contain the following. The startup budget must include any startup costs and reflect a program start date of no later than October 1st, 2022. So ensure you're putting in all of those costs that could be included in that startup. That's what we're looking for in there. Annualized budget must reflect a complete fiscal year of programming. Ensure that all the tabs are completed within the workbooks. And both budgets must include all expenses for the project, regardless of a funding source. So if you all are doing any in-kind contributions, we do want to see that on your project budget. We want to see what is charged to JWB, but we will also want to see any other funding sources so we get a good idea of any other funding sources as well as how much this project is going to cost in total. All budgets must be developed in accordance with JWB's financial policies and procedures for funded programs. There is the link. It's also in our RFP document. Additional instructions for the proposed program budget can also be found on the first tab of that Excel document labeled Instructions. Minimum criteria. So this is the criteria that you must meet for it to move forward for even the evaluation team to see. So this is your critical information. The proposal must be received by the due date and time of noon on January 31st, 2022. Again, bolded, different colors, highlight everything. We really want people to make sure. We've already had a couple of RFPs where the team didn't even get to review the proposal because it came in after the due date and time. I know that was a lot of time for them. We're disappointed, they're disappointed. We just want to make sure that we're successful with it getting through to the team to be able to review. The proposal signature form is signed by an authorized company officer. We do have the information, again, in our RFP. It also states that if you're unable to get what you can do if it's not outlined in there, we also have the information on how you can get authorization from your company or your organization if you're not that actual person that's in the that's stated in there. The proposer must not be on the Florida's convicted vendor list for public entities crime. Please see section 1.19. And the proposer must not be on the Florida's scrutinized company list. See section 1.20. Most likely you know if you're on these two lists, but please double check and make sure you would not be able to contract with us should you fall on any of those lists. Next page. Round one evaluation. The evaluation criteria and the points that's related to round one. Our program design is at the highest at 25%. Assessment and selection of standardized instruments at 25%. Experience and qualifications at 20%. Proposed budget at 20%. And proposed evaluation approach at 10%. Total potential points are 100. Now, if you look in the proposal where we've asked for the narrative from each of the agencies, there is a crosswalk between the questions and their evaluation criteria. So you want to take a look. It's not all fits one. There could be questions the team considers in the different criteria, but for the most part, the questions follow the criteria. Okay, next page. Round two evaluation. The top proposers in round one evaluation may proceed to an additional level of due diligence that will include follow-up questions and answers with the proposers, an interview with staff proposed to be assigned to these services, and a review of the proposer's financial resources. Again, those interviews will be held in March, as stated in our RFP timeline, which also can be found in our schedule of activities in the RFP. And the financial resources, we also state in the RFP what will be requested from the proposers. Round two, the top proposals will be evaluated on the following information collected to date against the criteria with the total possible points shown for each. Evaluation criteria and points. Again, program design at 25%. Assessments and selection of standardized instruments at 25%. Experience and qualifications at 20%. Proposed budget at 20%. And proposed evaluation approach at 10%. Again, for a total of 100 points. Best and final offer. The proposers may be asked for a best and final offer post-interview. JWB reserves the right to award a contract without a best and final offer. A high evaluation score does not guarantee that a proposal will be funded. Access to a variety of respite services across Pinellas County will be considered during the ranking and the recommendations, and that is in round 2. Award and agreement. JWB's intent is to award up to $2.65 million. It is anticipated that there will be multiple awards made. Award amounts may differ from what is requested based upon the dollars available and the types of services being proposed. A notice of award will be posted on JWB's website and emailed to all proposers. It is anticipated that the agreement will remain valid for a period of 16 months from the date of issuance unless terminated earlier in accordance with the agreement terms. So our information can be found on our JWB website at www.jwbpinellas.org. Any changes in meetings or due dates, written responses to questions, anything related to this RFP will be posted on our website. If you have any questions or concerns about this solicitation, please contact me. My name is Lorraine Hayes. My contact information is found on this slide. And I am going to turn it over to Susie to talk about the Tsl methodology and completion instruction.
Hi, everyone. Thank you for being here. I'm going to be going over the targeted service level and methodology form that you will be filling out as part of your application. If you have contracted with JWB before, you might have seen a different format for the methodology. So we've reformatted it here, and I just want to walk through it with you today. As Laura stated earlier, this form is fillable online, so we've taken the information from the form and put it in the slides. But when you're filling it out, you'll be able to do it in boxes directly in the PDF document, and it will be scrollable as well. So first page of the methodology, you'll see on top the fiscal year up there. You'll fill that out to say fiscal year 22 to 23. It'll be 1 year. For agency, obviously agency name there. If you are proposing a collaborative proposal, you should put the name of the lead entity there in the agency field. This will be effective as of June 1st, 2022. You'll see that box up there. You'll put the program name. Our strategic result area, as stated earlier in the presentation, is the prevention of child abuse and neglect. So that's what you'll put next to that box. And the program subtype is respite. So then we get into the different fillable boxes below where you'll be putting more of a description and your outreach and recruitment. So for the program short description, we're looking to capture a snapshot of your program. So you're using 500 words or less. You're going to just describe what your program does, and you're going to list any of the goals of your program, which there will obviously be goals associated with the respite program. Next box down, 500 words or less again, snapshot of how are you going to conduct your outreach and recruitment. So describe what that process looks like for program participants. How are you going to be recruiting participants into your respite program? Go next slide. So again, on the top, fill out the fiscal year, program name up there, and then you're going to go down to eligibility criteria. So we have these as different clickable boxes as well. You'll have the age criteria there. Like we said, this respite is open, this respite RFP is open to children ages 0 to 13. So if you are serving all of those age groups, you could fill up to middle school. If you're only serving a subset of those, you would only fill out the boxes for those children that you're serving. Gender criteria would probably be not applicable for this, but you'll see the different boxes. Geographic area served, if you're only serving certain parts of the county, is where you would put in that box. If other, please specify. If not, you would just click that box for countywide. And in the box for special population, because this RFP is open to, is about children who have more stress at home. If you're serving any special population, children with developmental delays, for example, you would put that in that box there. For acceptance and intake, you're going to describe the intake process for program participants, including if participants are required to prove eligibility at intake. You're going to talk about in this area too, the initial assessments that you will be doing with children and families on intake. Next box for transportation in 500 words or less. If you're providing any transportation for participants at all in your program, transporting participants anywhere, this is where you're going to put that. And if that's not applicable for your program, you'll list that there. Go next slide. So this box here, some of you might be familiar with what a logic model looks like. So this is kind of also the same kind of format, same kind of idea as a logic model, where you're going to put the what of what you're doing, the how of what you're doing, who is doing that, what you expect those outcomes to be, how you know you've reached those outcomes, which is our indicator measurements, what the source of data is for that, and the time of measurements. So at the top there, you'll see that's where our annual targeted service levels are. So that's where you're going to list the unduplicated number of adults, youth served through the program. If any of these don't apply, if you're not doing any group type respite care or anything, you can click that box for does not apply. So the top there, you'll see it says, of the second box, you'll see it says service component. So that's where you're going to put the name of the service component. For this, it would be respite care. For those of you who are going to be doing multiple modalities, if you're providing in-home care, group care, center-based care, you're going to put all of those in this box. You don't have to create separate tables for each type of care. We want to see that all here. So let me just go through each column just in case there's, to clarify what we're looking for here. So first, you'll see that there's text in the boxes there. You'll also see that in the methodology document in the application packet. As soon as you start typing in these boxes, that text will disappear. So the first column is our outputs column. So this is the what. This is going to list the targeted number of people in the service area and just a general description of services. So you would be like, for example, if you're doing in-home respite care, you could be, X number of participants served with in-home respite care would be an example of one thing you would write in that box. If you're doing center-based care, X number of participants served with center-based respite care. That's where we really want to see numbers of what, of service numbers of who you're serving and how many you can expect to see in each or one of those modalities. The next is where you're going to list your program activities and the duration of those activities. So the activities completed in the program. So some of those, like I said, might be the in-home respite care. You could also list assessments in that column too, because that's a program activity. Anything that's there and how long you expect those to take. The next column is for responsible parties. So who will be doing each of those activities? If it is direct care in a center or something like that, you would put, direct care staff or however you're talking about those staff members. Assessments, you could say, supervisory staff or whoever is responsible for that activity is going to be listed next to that activity in that column. So the expected outcomes are going to be your performance measures. So we already have those listed in the respite RFP. So you would just be copying those there of 95% of children, will not have an episode of child abuse within the year. Things like that would go in that column. Now, I want to explain a little bit more about the indicator measurements column because that might seem a little more confusing. So you have your outcomes in the column to the left of that. For indicator measurements, it's going to be how do you know you have reached that expected outcome? So for the example that we have here, for an expected outcome could be 50% of participants will have a learning gain on the FSA ELA exam as indicated by Pinellas County Schools. That would be the outcome. So how would you know that? You would know that because the participant has received an increase in the score from previous score. So as it applies to respite care, whatever type of assessment you choose, you could do the same thing there. So, 95% of children will see an increase on whatever assessment you choose. The indicator would be that there's an increase in the raw score from the initial assessment to post-assessment. So that's how you would know that. The data source is where you actually pull that data from. So whatever the name of your assessments would be would go there. Whatever other ways that you are collecting data, that would also come from there. FISFIN, that would be there as well. And then we move to the last column, which is time of measurement. So when are you doing that? So for assessments, we want you to be assessing children in families multiple times throughout the year. You will list that here of, twice per year, 4 times per year, however long you are, doing those assessments, however many times you're doing those assessments is where you're going to put those. At the bottom there of this table, you'll see an equation list there. How did you arrive at the number served above? So that would be related to your annual targeted service levels in the table above. And you're going to put how you came to that number, how you determined that. And then the comment section there, if there's any other things that you think will help clarify anything in the table that you're not able to explain, you'll put that there as well. And then just one last thing about this table, it is scrollable, so if you think you're putting too much in each column, that's okay. You can scroll through the columns because it's a fillable document. Okay, so the next page is where you're going to put the average length of stay, service completion, and closure for children and families. So still short, kind of, getting to the point, 750 words or less. You're going to include information regarding the average length of stay for children and families in the program, what the criteria for completing that program is, and what that process looks like to close children and families out of the respite care program. And also, if applicable, you're going to click that box next to it there, that you're going to provide details on if you provide follow-up services for children and families, and if they're receiving anything like that. So service availability, you're going to list all the sites associated with the program here. That's going to be where your administrative offices are, program sites if you're doing center-based or group care, and service delivery sites as well. So if you're doing in-home respite care, you don't have to list, obviously, every home that you're going to in this table, but you can put the site name down there, or you can put up here, there's a box that says site information changes regularly. If you are providing in-home respite care, you can click that box there. So the site name you'll see there, for the site type, there's a drop-down box that we don't have in the presentation here, but you'll see in the actual document. And in that site type, you'll see administration. It could be a combination of those. It could be the administration site and the program site. It could be the administration site and the service site, the program site alone, the service delivery site alone, service and program, or all of the above. So the service component you're going to take from the chart on the previous page, and you're going to just list that there. You're also going to put the contact information for that specific site here in the next column. Days of the week in which that service will be happening. If it's administration, it could be, Monday through Friday, 9 to 5, something like that. And Monday through Friday, and then hours of operation, 9 to 5, or however long that you are actually conducting business at that site. So last page, you're going to include some of these required attachments, which obviously need to go into the RFP as well, and just click the boxes for all of the attachments that you have there. So check off that you have your organization chart attached, just keep track, job description attached, and your data quality manual. And then, obviously this is a sample methodology for your application, but if it's approved, this is where we'll have the signatures go for all of us to approve the methodology and make sure that it passes. So we have a snapshot of your program. Thank you.
Okay, we're going to take about a 10-minute break. If you want to run to the restroom, you want to write down any questions you have for us, you can hand them to me. And then we'll come back, and that will be at 11. We'll come back and we'll answer all of your questions. Please remember, this is just a reminder that all the responses to the questions are preliminary in nature. The actual official response will be on that questions and response document that is released in January. And we will take a 10-minute break. Thank you. Okay, we're going to go ahead and get started with the questions and responses. We have a couple of questions that we've received via email prior to this meeting, and then we have some that were submitted here. Again, if you have any follow-up questions for those of you who are here, just please raise your hand. Diana is going to ask you if she fully answered the question, or if you have any other questions from it, and they'll answer it. Diana and Karen will be answering questions. If you do ask a question, a follow-up question, we are going, Diana is going to repeat your question so that those on YouTube can hear the question because they can't hear it just from the room. Okay, Diana?
Hello. All right, I've got a couple questions here, and there were actually two that we received prior to today that we were going to answer. The first one wasn't exactly sure what the question is, so I know we reached out to see if we could get the question repeated so that we can answer that, and I don't think we've received anything yet. But if that person's listening or we get that question later, we'll include it in our official responses. But the other question I received prior to today was, I'm a new nonprofit as of February 2021. I would like to know if I qualify for this proposal. And I just would direct everyone to Section 2.6 of the RFP, which is on page 16, and it's the minimum qualifications. And so those are the required qualifications. It does not have a qualification regarding length of time in operation. There is letter D that the agency must have an annual operating budget over $500,000 or operate under an administrative services organization or collaborative as determined in JDB's sole discretion to ensure the proper administration of JDB funding. So, look through all A through K for the qualifications, including that one, but if that didn't answer the question for that person, please submit an additional question if that didn't cover it. And then today's questions were, I've been creating programs for families since 1999. I since created a nonprofit. How do I work with JDB since I don't have a budget of $500,000 as a vendor and I have not filed taxes yet? So back to that same 2.6 letter D. So this is JDB's board policy that, an agency must have an annual operating budget over $500,000 or operate under an administrative services organization or collaborative. So what JDB is looking for is to make sure that funds are, properly administered and accounted for. That if you seek out an entity, a bookkeeping, accounting entity that can, help administer those funds. If you, during this process, if you want to, submit an additional question, if you have, an agency or an entity in particular in mind of who could fill that ASO role and you want to know if this particular entity would meet that requirement, you could submit that to us and we could answer it if we get it in time before the responses are due. But if not received for a particular entity, we'd just be looking in your proposal of who would be filling that role for you, and then there is the caveat that it's as determined in JDB's sole discretion. So if you can submit what you plan to do to have that requirement met, great. If not, just include it as part of your proposal. Any other follow-up questions on that? Or did that cover it for now?
I was thinking about that because I could probably approach NAMI because we kind of like are on the same path. But for me as a nonprofit, for me to gain funds so I can actually run the people that I need in the agency or the clinic, how would I get that if I'm always working under NAMI? And like, where's the funding? Where will it go? NAMI or, that's
So I can give an example too. So we have some agencies now that JWB funds, and they utilize what we call an ASO, which is car rigs and Ingram. So, you know, we contract with those agencies. We contract on a cost reimbursement basis, and but the car rigs and Ingram, CRI, you know, pays all their bills, does all their AP, you know, completes the budget, the annual budget that's required to be submitted to JDB. So they basically handle all their finances. They work with their auditor at the end of the year to you know, complete all the work that needs to be done to get your audited financial statements. So they're acting in that role for them. So that way those agencies can focus on programming and, you know, the other administrative requirements that they have, but that they've got this accounting firm essentially that's providing all the accounting work for them. So it's just an example of, is this from the, yeah, so Laura's question was, could they collaborate under a lead agency for the proposal? Well, so the policy is that they operate under an ASO or collaborative, but whoever it is, it's just the requirements that somebody's filling that financial administration role if the operating budget's under 500,000. Okay, did that answer it, at least for now?
Well, I'm just thinking, I mean, because I do have an accountant, I have to have that myself.
Mm-hmm.
I don't know if I would have to get a different accountant, that somebody that would fall under the other guidelines that you were talking about.
Well, I think it'd be good to submit a follow-up question to us explaining how you're getting your accounting needs met, and I know you said you hadn't, you know, had the audited financial statements yet, but, you know, who would be filling that role? You know, how would you fill that role? And that way we could give you a specific response, you know, to your specific situation too. Sure. All right, so the other questions are, what is the allowable maximum budget request for the startup period of June 1st to 9/30/2022? So when we say that funds are available, we have an available funds of $2.65 million, we mean annually. So, and I'm going to read your second question too, because I'm going to kind of answer both of them at the same time, which is, the second question is, what is the allowable maximum budget amount for the annualized period also of 10/1/2022 to 9/30/2022? So for the annualized amount is the $2.65 million. We could also award up to $2.65 million this fiscal year as well. You know, although, you know, we understand there may be some startup costs initially that might make the amount of the budget in the first year be higher, but the amount in the first year is also prorated, so that's also going to make it less. So I would really, I guess, focus first on the annualized amount, you know, knowing it's up to 2.65, and then whatever is needed for that first year of startup that's also prorated. You know, we could go up to 2.65 in that year too. Maximum page limit for the narrative proposal. We do not have a maximum page limit in this one. There are a lot of questions, 34 included, you know, so you would be restating the question and providing the answer, and so we did not attempt to try to put a max page limit on that. And then the last question I'm going to leave for Karen Bogus.
Okay, so the question is, did JWB set a target number of children to be served in this RFP? And the answer is no, we have not. I think trying to even begin to figure out with all the different modalities and some of the requirements for licensing under those modalities, we certainly could not come up with a targeted number. So the answer is no. is that the end of all the questions?
Yeah, unless we have any other follow-up ones. No?
Well, thank you everyone for who's listening, and thank you for those of you who came today.
Just another, again, you have until December 31st at noon to ask any additional questions. Please follow the guidelines in the RFP, but just making sure you all know that there is still sufficient time to post any questions for those who have come, and then also, you know, any follow-up questions you may have. Oh,
Is it possible to actually go on Zoom with your board and so I can present myself with my a PowerPoint of what I've done in the past and where I want to go with it?
I'll let you take that one.
So I'm just gonna, I think, summarize the question for those that are, they can only hear through this microphone. But the question was, could you present to our board, the idea of where you're going? I will say for our board, our board meets monthly. They do take public comment, but I know on those public comments, it does say that public comments are not the time for new funding requests. So it wouldn't be appropriate to have a new funding request to the board. For this particular RFP, we have an evaluation committee that's evaluating the proposals. And the evaluation process is first the written proposal, then they're going to narrow it down to top proposers, and then in the next round they're going to invite those to come back for a presentation or an interview and questions and responses. But the first step is that written proposal. But again, if there's any questions specific that you can think of between now and December 31st, where you want to gauge if what you're thinking of is, we could help maybe clarify. We could try to answer those questions in a written response. And I think Laura already mentioned it, but I'll just repeat it too, that, our official written response, will come out after December 31st. So just in case, as a disclaimer, if anything that, we say in our written response is a little different than what I've said here today, the written response is the official response. But I think any other, does that cover it? Okay.
Want to say if you do have the room?
Oh, yeah, go ahead. I'll leave these for you too.
For those on YouTube, thank you for watching. That concludes the YouTube presentation.